So this is the location of the scapula, okay, on the upper part of the back of the chest, and it articulates with the acromial end of clavicle and the head of the humerus. So scapula lies over second to seventh rib. See here, first, second, from second, third, fourth, fifth, sixth, seventh. Second to seventh rib. It lies against second to seventh ribs. And it is a flat triangular bone. You can see it has anterior surface is known as the costal surface. Okay, so this one is costal surface. It is concave. Anterior surface is the costal surface, and dorsal or posterior surface has the spine of the scapula. So this part is this is posterior surface or dorsal surface of the scapula. There are three borders: superior border, medial border, lateral border. Okay, this one is superior border. This is the anatomical position. Okay, gun holding position. So this is superior border, lateral border, and medial border of the scapula. And acromion articulates with the clavicle. Here it articulates with the acromial end of clavicle to form the acromioclavicular joint, plain type of synovial joint. Next is glenoid cavity. This one is glenoid cavity. It articulates with the head of the humerus. And coracoid process projects forward and provides attachment for the muscles and ligaments. So this process, this bent finger shaped process, this process is the coracoid process. It gives attachment to different muscles and ligaments. Okay, see here. So this is lateral border, glenoid cavity, superior border, medial border. Three angles are there: superior angle, lateral angle, inferior angle. Okay, and three processes are this spinous process, acromion process, and coracoid process. Okay, and there is a notch near the root of the coracoid process. This is known as suprascapular notch, and it is breached by a ligament known as transverse scapular ligament, which forms it into a foramen. So how will you determine the site? This is very, very important for every bone. Site determination and anatomical position. When you are giving viva in a bone stable, you have to hold the bone in anatomical position. After that, you start describing the bone. Okay, you have to know the points for anatomical position. So the side of the scapula can be determined by holding the scapula in such a way that the glenoid cavity faces laterally forward and slightly upward at an angle of 45 degree from the coronal plane. See here, so this is scapula of right side. Hold it with your right hand in gun holding fashion. So this is the coronal plane. Plane of the scapula is forming angle of 45 degree with the coronal plane. And this is glenoid cavity. It is facing laterally, slightly forward and upward. Okay, so this is how you hold it in anatomical position. Everyone has seen the anatomical position. Okay, so first place it in anatomical position. So this is scapula of right side, and hold it with the same hand to which side it belongs. Okay, this is right scapula, so I am holding it with right hand. If it is left scapula, you have to hold it with left hand. Okay, and the coracoid process is directed forward. See, in anatomical position, this coracoid process is directed straight forward, and the self-like spinous process is directed posteriorly. Self-like spinous process is directed posteriorly. Okay, so this is forward, anterior, posterior, you can know, and this concave costal surface is anteriorly placed, and this spine is posterior. So anterior, posterior is determined like this. Medial, lateral is determined. This glenoid cavity will be lateral, and superior, inferior, this processes, suprascapular notch, all these are present in the superior aspect. Okay, and inferiorly only there is inferior angle. Okay, so three determination points. Next we are going to borders of the scapula. First is superior border or superior margin. It is the upper edge of the scapula, and that runs next to the clavicle. Okay, see here, this is clavicle of the right side. it is articulating like this. Okay, so this superior border is almost parallel to the clavicle. During superior border of the scapula, this border is the superior border of the scapula, and clavicle was articulating like this. Okay, so it is almost parallel to the superior border. So runs next to the clavicle, and the omohyoid muscle attaches near the suprascapular notch. Here is the suprascapular notch. Near the notch, attachment of the inferior belly of omohyoid. Okay, superior belly was arising from the hyoid bone. Next is medial margin or medial border. This is the medial margin or medial border. Is the medial edge of scapula and also called the vertebral border. Okay, it is lying near the vertebral column, that's why vertebral border. And this area is an attachment point for the Levator scapulae, rhomboid major and rhomboid minor on the dorsal aspect, and serratus anterior muscle on the ventral aspect. See, from this superior angle to the apex of the spine, here is the Levator scapulae. Okay, then to upper two-third, here is the rhomboidus minor, and below is the rhomboidus major. And on the costal surface of this border, serratus anterior. Okay, 1, 2, 3 sleeves, and rest of the 5 near the inferior angle of the scapula. On the costal aspect or anterior aspect of this medial border, there is attachment of serratus anterior muscle. Serratus anterior muscle arises from 8 sleeves. Okay, so first, second, and third sleeve arises along this border, and rest of the 5 sleeves arising from the costal surface of the inferior angle. Okay, understood? And this muscle prevents the winging of the scapula. Winging means prominence of the medial border on the back. Okay. During overhead abduction, there is rotation of the scapula. This is done by this serratus anterior. Okay, next is the lateral border or lateral margin. See, this one is the lateral border or lateral margin. This is the lateral edge of scapula, and the teres minor, teres major muscle attaches along this border on the dorsal aspect, and it is also called axillary border. Here lies the axilla. That's why near the axilla, so axillary border, and here is the attachment of teres minor, upper two-third, teres major, lower one-third. And teres minor arises from 2 sleeves. In between the 2 sleeves, there is one depression. Depression is for the circumflex scapular artery. Okay, this impression here formed along the lateral border on the dorsal aspect. This is for the circumflex scapular vessels. Okay. Next, we are going to angles of the scapula. First is superior angle. This one is the superior angle. So it is the sharp curvature at the junction of superior and medial border. So it is junction of superior border and medial border. This one is the superior angle. And this area is an attachment point for Levator scapulae. We have learned previously. Here is the attachment of Levator scapulae. Next is the lateral angle. Here this glenoid cavity forms the lateral angle. Okay. This is the junction of superior border and lateral border. Superior border, lateral border, at this junction is the lateral angle. It is slightly concave. Okay, so you can see the concavity. Lateral edge forming the glenoid fossa. Lateral edge forming glenoid fossa, which articulates with the head of the humerus. This glenoid cavity articulates with the head of the humerus. This is humerus. It articulates with this glenoid fossa to form the glenohumeral joint or shoulder joint. Okay. So next is the inferior angle. This one is the inferior angle. It is a sharp curvature formed at the junction of medial and lateral margins. So this is formed by joining of medial and lateral margin, inferior angle. And it is an area of attachment for the teres major and latissimus dorsi on the dorsal aspect and lower 5 slips of serratus anterior muscle on the ventral aspect. Okay, so teres major is here. So teres major and also latissimus dorsi on the dorsal aspect, and on the ventral aspect last 5 slips of the serratus anterior. Okay. Next we are going to different processes of the scapula. All are 3 in number here. 3 borders, 3 angles, 2 surfaces. Okay, and 3 processes are there. 3 processes are spinous process, acromian process, and the coracoid process. Okay, so scapular spine, this one is the spine. It is a long ridge that runs diagonally across the upper posterior surface of the bone. You can see the spine, and the trapezius is attached over the upper lip. This is crest of the spine. So along the upper lip, trapezius insertion is there, and posterior fibers of deltoid originates from the lower lip. Here is the lower lip of the spine. Here is origin of the posterior fibers of the deltoid. Deltoid muscles are 3 types of fibers: anterior, middle, and posterior. Anterior fiber was originating from the clavicle. Middle fibers from the lateral border of the acromion process, and posterior fibers from the lower lip of the crest of the spine. Okay, and all 3 are joining together, forming the rounded contour of the shoulder and inserted into the V-shaped deltoid tuberosity of the this humerus. Okay. Next is the acromion process. See here, this one is the acromion process. It is a lateral fan-like extension of the spine, extending from the lateral aspect of the spine, and it also is an attachment point for the trapezius and posterior fibers of the deltoid. Okay, so along the medial margin there is continuation of the insertion of the trapezius, and along this lateral margin there is origin of the deltoid, posterior fiber and then middle fibers. Okay. Next is the coracoid process. See, this one is the coracoid process. Coracoid process is a curved hook-like anterolateral projection located above the lateral angle. See, this glenoid cavity is forming the lateral angle. So just above it, it is originating, and it is a bent finger-like process. Okay, curved hook-like. Next we will discuss these processes in details and their attachments. Okay, first is the spine of the scapula. So this triangular self-like projection is the spine on the posterior aspect. So spine has 2 surfaces. This is superior surface, here is the inferior surface. Superior surface, origin of supraspinatus. Here is the origin of supraspinatus. Inferior surface, origin of the infraspinatus. Okay, so this is supraspinous fossa, this is infraspinous fossa, and anteriorly there is subscapular fossa. So same muscles are originating from the named fossas. Okay. Next is the inferior surface, origin of infraspinatus. Next, it has 3 borders. Spine has 3 borders. First is the anterior border. It is attached to the dorsal surface of the scapula. See, this one is the anterior border which is attached to the dorsal surface of the scapula. Next is the posterior border or crest of the spine. Here is the posterior border or crest of the spine. And this crest of the spine has upper lip and lower lip. We have previously discussed. Upper lip, there is insertion of the trapezius, lower lip, origin of posterior fibers of the deltoid. And next there is lateral border or base of the spine. Here, this is the lateral border or base of the spine. It bounds the spinoglenoid notch. Okay, spinoglenoid notch lies between the spine and the glenoid cavity. Okay, so that's why the name is given spinoglenoid notch. So this lateral border or base of the spine, it is forming boundary of the spinoglenoid notch. Okay, and through which passes the suprascapular vessels and nerve through this spinoglenoid notch. And here is the apex of the spine. Okay, apex is lying at the medial border. Understood? Near the apex there is a flattened triangular area. Okay, so lateral border or base of the spine bounds the spinoglenoid notch, Apex lies at the medial border of the bone at the level of T3 spine. This vertebral level is important. Okay, so apex of the scapula lies at T3 spine. Okay, and scapula extend from 2nd to 7th. Okay, 2nd to 7th rib. Next, we are going to acromion process. So, this platen process is the acromion process. Acromion process projects forward almost at right angle from the lateral end of spine and overhangs the glenoid cavity. You can see the location, it overhangs the glenoid cavity and extends from the lateral end of the spine. Okay. Next, it has a tip. This part is the tip of the acromion. Most projecting part is the tip of the acromion, and the coracoacromial ligament is attached to the tip of acromion. Coracoacromial ligament was connecting the acromion process with the coracoid process. Okay, and together they are forming a arch. Okay, coracoacromial arch. This acromion process, coracoacromial ligament and coracoid process, and this coracoacromial arch prevent the shoulder joint from dislocation. Okay, upward dislocation of the shoulder joint is prevented by this arch. That's why the downward dislocation is more common. Okay. Next, superior surface. Superior surface is rough and subcutaneous. This is superior surface, which is rough and subcutaneous. Inferior surface is smooth and related to the subacromial bursa. Here, inferior surface is smooth and here lies the subacromial bursa, which prevent friction between the tendon of the muscle and the shoulder joint and the bone. Okay. Next is the medial and lateral borders. They continue with the upper and lower lips of the crest of the spine of the scapula respectively. See, this is medial border, this is lateral border, which is continuing with upper lip and lower lip of the spine of the scapula. And medial border, there is insertion of the trapezius and circular facet near the tip articulates with the lateral end of the clavicle. Here, this is the circular facet at the anterior end of this medial border. It articulates with the lateral end of clavicle to form the acromioclavicular joint. Okay, plain type of synovial joint is formed. A lateral border gives origin to the intermediate fibers of the deltoid. Here, intermediate fiber or middle fibers of the deltoid are originating from the lateral border of the acromial process. Next is acromial angle. This is important for your surface marking. Acromial angle is given as a point for surface marking. It is the junction of the lateral border of acromion and lower lip of crest of the spine of scapula, and it is an important bony landmark. Lower lip of the crest of the spine of scapula, lateral border of acromion, the junction point is the acromial angle. Okay, understood? Next, we are going to the coracoid process. This is coracoid process. Coracoid process provides attachment to 3 muscles and 3 ligaments. So, the short head of Biceps brachii and Coracobrachialis, these two originates from its tip by a common tendon. Here, this is tip of coracoid process. From here, 2 muscles are arising. Short head of Biceps brachii and Coracobrachialis. And among these two, Coracobrachialis is lying medially. Okay. So, that has been written here. This is also asked in your viva. Which muscle is medial, which is lateral? Biceps will be lateral because the short head have to join with the long head. Long head of biceps originating from the supraglenoid tubercle. And from the infraglenoid tubercle arises the long head of the triceps brachii. Okay. Next, there is pectoralis minor muscle is inserted on the medial border of the upper surface. Here, medial border of the upper surface, pectoralis minor muscle is attached. It inserted here. Next is coracoacromial ligament is attached to its lateral border. Here is the lateral border. Coracoacromial ligament is connecting this lateral border of coracoid process with the tip of the acromion. Okay. Next is coracohumeral ligament. It is attached to its root adjacent to the glenoid cavity. Here, near the root of the coracoid process, near the glenoid cavity, coracohumeral ligament. Okay. Next is another ligament, coracoclavicular ligament, also known as rhomboid ligament. It has two parts, conoid part and trapezoid part. You have read during the clavicle this coracoclavicular ligament, conoid part and trapezoid part. The conoid part is attached to the knuckle. Knuckle means bend. Okay. So this bend, near the bend, the conoid part is attached and the trapezoid part is attached to a ridge on its superior surface. Here on the ridge on the superior surface. Trapezoid part is attached to a ridge on its superior surface between the pectoralis minor muscle medially and the coracoacromial ligament laterally. Okay, understood? So these three ligaments are attached over this process. Okay, coracoacromial, coracohumeral, coracoclavicular. And muscles are pectoralis minor and other two muscles are biceps brachii, short head of biceps brachii and the coracobrachialis. So three muscles, three ligaments. Okay. Next we are going to different fossas. Okay. So there are supraspinous fossa. This is supraspinous fossa. It is slightly depressed area located superior to the spine and the supraspinatus muscle attaches to this region of the scapula. Next is infraspinous fossa. This is infraspinous fossa. This is a large, slightly depressed area located inferior to the spine. Okay, inferior to the spine, that's why infraspinatus. And it serves as an attachment point for the infraspinatus muscle. Next is the subscapular fossa. This one is the subscapular fossa on the costal surface. It is a large, slightly depressed region in the middle of the scapular anterior surface and the subscapularis muscle attaches to this region of the bone. Okay, understood? Next is other important features. First is the suprascapular or scapular notch. See here. Here is the suprascapular notch. It is a small groove located medial to the coracoid process. This is anatomical position. So this notch is just medial to this coracoid process. Okay. And it is converted into a foramen by transverse scapular ligament. Okay, converted into foramen. And it forms a passageway for the suprascapular nerve. Okay, this is very frequently asked in your viva. Nerve passes through the foramen below the ligament and the vessels passes above the ligament because vessels need to expand. And if it passes through the foramen, it is a passing through closed space. There is no chance of expansion. That's why nerve passes through the foramen, vessels passes above the foramen. Okay, suprascapular vessels and nerve. Next is the glenoid cavity or glenoid fossa. Okay, this is glenoid cavity or glenoid fossa. It is pear-shaped depression. So it is a pear-shaped concavity at the lateral angle and it forms a shallow socket for articulation of head of the humerus. You have seen it. So here this glenoid cavity articulates with the head of the humerus to form the glenohumeral joint or shoulder joint. Okay. Next is the infraglenoid tubercle. Just at the lower end of glenoid cavity, this impression is the infraglenoid tubercle. And it is a small prominence on the inferior margin of the glenoid fossa, serves as an attachment point for the long head of Triceps Brachii. Infraglenoid tubercle, long head of Triceps Brachii. And supraglenoid tubercle. Here is the supraglenoid tubercle. It is a small prominence on the superior margin of glenoid fossa, gives origin to long head of the biceps brachii muscle. Next, we are going to anastomosis around the scapula. Okay, this is important for your theory. Okay, rest of the portion we have discussed important for your bones viva. This is comes in your theory short note. Okay, anastomosis around the scapula. So you can practice a schematic diagram like this, and you write down this one. It is around the scapula, collateral anastomosis are observed between the branches of first part of the subclavian artery. Here is the first part of the subclavian artery. From one branch is the thyrocervical trunk. This thyrocervical trunk is giving suprascapular artery and the dorsal branch of the transverse cervical artery. Okay. So in each of the fossas, three fossas we have discussed: subscapular, suprascapular, supraspinous and infraspinous fossas. These arteries are anastomosing. Suprascapular artery and deep branch of transverse cervical artery from thyrocervical trunk of subclavian artery, and with the circumflex scapular artery. Here is the circumflex scapular artery, which is arising from the subscapular artery from branch of third part of the axillary artery. Okay. So anastomosis occurring between the first part of the subclavian artery with the third part of the axillary artery. Okay. And go to the infraspinous fossa. And over the acromion process also there is another anastomosis. Here acromial branch of the suprascapular artery from the subclavian artery with thoracoacromial artery and posterior circumflex humerus artery from the axillary artery. These arteries are anastomosing over the acromion process. So these are the anastomosis around the scapula. Okay, very important for your theory sort of. Next is the joint formed by the scapula, very frequently asked in your viva. Okay, and type of joint is very important. So first is shoulder joint. Shoulder joint, it is formed between the glenoid cavity, here is the glenoid cavity, and the head of the humerus, and it is a ball and socket type of synovial joint. Okay, around the margin of this glenoid cavity, glenoid labrum is attached. Okay, and it is converted into a cavity where and forms the socket for the head of the humerus. Okay, and this glenoid labrum is example of this fibrocartilage. Okay. Next is the acromioclavicular joint. Acromioclavicular, here is the acromioclavicular joint is formed between the acromial process of scapula and acromial end of the clavicle, and it is a plain type of synovial joint. Okay, understood? So type of joints are important. Shoulder joint is ball and socket type of synovial joint, and this acromioclavicular joint is plain type of synovial joint. Okay. See here, so glenoid cavity, spinoglenoid notch, suprascapular notch, superior border, medial border, lateral border, superior angle, lateral angle, inferior angle, and borders are superior border, medial border, lateral border. Supraglenoid tubercle, infraglenoid tubercle. Silence everyone. And these are the processes: coracoid process, acromion process, and posteriorly here is the spine. And this is here another process is shown. This is not present in all the persons. Meta-acromion process, small projection near the origin of the acromion process. Okay. Next we are going to ossification of the scapula. Ossification of clavicle is very important. Okay, explain why question comes. This ossification you can remember, number of centers you remember, not frequently asked. And again humerus ossification is very important. Okay, so ossification of scapula is cartilaginous. It ossifies from 8 centers, 1 primary center, 7 secondary centers. One primary center appears in the body at the 8th week of intrauterine life, and the secondary center appear in these regions. 2 for the coracoid process, 2 for the acromion process. 1 center appears in each of the medial border, inferior angle, and lower part of the rim of the glenoid cavity. Okay, so these are the locations of the secondary center. Next, the primary center in the body and the secondary center in the coracoid process appear in the 8th week of intrauterine life and the first year of postnatal life respectively. And they fuse at the age of 15th years, and other center fuse with the body of scapula by about 28th year. Okay, so this is the ossification of the scapula. So you must remember 1 primary center, 7 secondary center, total 8 centers. Primary center means it appears before birth. Secondary center appears afterward. Next, the muscles attached to the scapula and their functions. So first is deltoid muscle and supraspinatus. Okay. So deltoid muscle, it has three types of fibers. This is the deltoid muscle forming the rounded contour of the shoulder. It has anterior unipinnate part from the upper surface and anterior border of lateral 1/3 of the clavicle. Middle fibers or multipinnate fibers from the lateral margin and upper surface of the acromian process. And posterior unipinnate part from the lower lip of the crest of the spine of scapula. And these together forming the muscle belly inserted into deltoid tuberosity of the humerus here. So here is the deltoid tuberosity, V-shaped deltoid tuberosity of the humerus. Here it is inserted. Nerve supply is axillary nerve. This is important short note. Deltoid muscle is given as a short note. Okay. And in your OSPE, you have to identify important muscles, nerves, vessels, and related questions will be asked. For that also deltoid is important. And when writing short note over any muscle, you have to write 4 points. Okay. Origin, insertion, nerve supply, and action. Okay. So for it, nerve supply is by axillary nerve. Action is act as main muscle for abduction of the shoulder joint. So this will be the overhead abduction of the shoulder joint done by the deltoid. Its anterior part is flexor and medial rotator of the humerus, while posterior part is extensor and lateral rotator of the humerus. Next is supraspinatus. From the supraspinous fossa originates the supraspinatus. It lies deep to the trapezius, arises from the supraspinous fossa of scapula, fibers cross above the shoulder joint and is inserted into the greater tubercle of the humerus. It stabilizes the shoulder joint and abducts the humerus, and it is supplied by the suprascapular nerve. Okay. Next, muscle that adduct the upper arm. Okay. So these two were abducting, supraspinatus and deltoid. First, 0 to 15 degree of abduction is done by the supraspinatus, and rest up to 90 degree abduction done by the deltoid, and rest up above 90 degree done by the help of the serratus anterior, rotation of the scapula, deltoid, all rest. Okay. Next is muscle that adduct the upper arm are the pectoralis major, latissimus dorsi, teres major, and subscapularis. Okay, these three are attached near the intertubercular sulcus of the humerus, and there is subscapularis lesser tubercle. See here, this one is pectoralis major attached, originates from the sternum and the clavicle. Okay, and inserted over the lateral lip of the intertubercular sulcus. Sternal half of clavicle, upper half of sternum, aponeurosis of external oblique muscle. Insertion into lateral lip of the intertubercular sulcus. Action is adduction, medial rotation, and flexion of the shoulder. Nerve supply is medial lateral pectoral nerve. Root values are given C5 to C8 and T1. Next is latissimus dorsi. See, this one is the latissimus dorsi muscle. So it is a very broad, flat and triangular muscle in the lower back, overlapped by the lower part of the trapezius, and it originates from the lumbar fossa. Here lies the lumbar fossa, deeper plane, spines of the lower 6 thoracic vertebra, spine of lower 6 thoracic vertebra, lower 3 and 4 ribs, and inferior angle of scapula. Here is the inferior angle of scapula. So this is the origin, and insertion into the floor of the bicipital groove or intertubercular sulcus. Okay, insertion. And nerve supply is thoracodorsal nerve. Action is adduction of the shoulder joint. Next is teres major. See, this one is teres major. Okay, origin from the dorsal surface of the inferior angle of scapula. Here is, we have read origin of the teres major. Insertion into the medial lip of the intertubercular sulcus of the humerus. Next, action is extends the arm from the flex position and it adducts, medial rotates the arm. And nerve supply is lower subscapular nerve, root value C6, C7. Next is subscapularis. Originates from the subscapular fossa of the scapula. Here in the subscapular fossa, medial 2/3 of the subscapular fossa and lateral border of the scapula. Okay, this lateral border here also origin of subscapularis. And insertion and you can see some ridges over the costal surface. These are intermuscular tendons of the subscapularis. Intermuscular tendons give strength to the muscle. So, insertion into the lesser tubercle of the humerus. Here, lesser tubercle of the humerus, and this is the bicipital group. Rest of the three was inserting here. Action is stabilize the shoulder and prevents anterior displacement of the shoulder, helps in medial rotation and adduction of the arm. Nerve supply is upper and lower subscapular nerve. Root value is C5 and C6. What is rotator cuff muscles? Important short note for your theory. Rotator cuff muscle, you have to write all the four muscles. Those muscles adducting the shoulder joint. So, four muscles which are attached over the greater and lesser tubercle of the humerus. Supraspinatus, infraspinatus, teres minor and subscapularis. These four are forming the rotator cuff. Name given to the tendons of subscapularis, the supraspinatus, infraspinatus and teres minor, which are fused to the underlying capsule of the shoulder joint, and the cuff is important in stabilizing the shoulder joint. Okay, so these are the muscles you can see. This is subscapularis, supraspinatus, infraspinatus, teres minor. All these are fusing with the capsule of the shoulder joint and stabilizing the joint. Next, anterior flexor muscles of the forearm. Okay, so three muscles are there: biceps brachii, brachialis and coracobrachialis. So these two origin you have seen: biceps brachii, two heads; coracobrachialis. So biceps brachii, long head, originates from supraglenoid tubercle of the scapula. Here is the long head originated from supraglenoid tubercle, and this passes through the intertubercular sulcus of the humerus. Long head passes through, and short head originates from apex of the coracoid process. Here is the short head. So these two heads join to form the muscle belly and inserted into the radial tuberosity of the radius. Okay, and action is flexure of the supinated forearm. Okay, so this is supinated position of the forearm. In this position, flexion is done by the biceps brachii. So it is a powerful supinator of partially flexed forearm, and nerve supply is musculocutaneous nerve, C5, C6. Okay, brachial plexus have been done in your theory? No. Okay, you have read? No, during axilla. Okay. Next is brachialis. Brachialis originates from, it is also one flexor muscle, originates from the humerus, distal half of the humerus. We will discuss it during the humerus. Next is coracobrachialis. See, this small muscle is the coracobrachialis. It is a elongated muscle in superomedial aspect of the arm. Origin and insertion, it originates from tip of the coracoid process of scapula and inserts into the medial aspect of the shaft of the humerus. Here, this is from origin from the tip of the coracoid process and insert into the medial aspect of shaft of the humerus. Action, it flexes the arm, and nerve supply is musculocutaneous nerve. Okay. Next is the triceps. This is the extensor muscle of the forearm, triceps. So it has three heads, arises by three heads from which it takes name. Three head, that's why the name is given triceps. Biceps are two heads, that's why the name is given biceps. Three heads are long head, lateral head, medial head. Long head we have read today originates from infraglenoid tubercle of scapula. Lateral head from ridge above the spiral groove on the posterior surface of shaft of humerus, and medial head from the lower half of posterior surface of shaft of humerus below the spiral groove. See here, this is long head originating from infraglenoid tubercle. This is lateral head and this is spiral groove. Above the spiral groove, lateral head, below the spiral groove, medial head. All three heads are joining and inserted over the olecranon process of the ulna. Okay. All the fibers insert into the posterior part of upper surface of olecranon process of ulna, and it is a extension of the elbow joint. Nerve supply is radial nerve. Okay. Okay, that's all. So these muscles are related muscles to this scapula. Okay, and some Usta humerus we have also discussed. So you will be able to side determine for scapula. So you have to hold it in gun holding position. This is the anatomical position, and hold it with the same hand to which side it belongs. Plane of the scapula will form a angle of 45 degree with the coronal plane. Okay, and glenoid cavity will face laterally, slightly forward, slightly upward. Okay, and spine will be placed posteriorly, anterior, posterior, medial, lateral instant, superior and inferior. All these processes, suprascapular notch, all these are placed on the superior aspect. Okay, and inferior angle on the inferior aspect. So, and this coracoid process is projecting directly forward. Okay. Okay, so these points you have to remember for holding it in anatomical position and for the side determination. So this will be scapula of the right side. And here is the scapula of left side. See, you have to hold it like this with the left hand, gun holding position. Make an angle of 45 degree, that is must. Okay, and see the direction of the glenoid. Above, slightly forward, slightly upward, and this tip of acromion directly forward. Spine will be posteriorly placed. So this is scapula of left side. Okay, and you have to know how to articulate. So this is clavicle of left side. So you will articulate like this, forming the acromioclavicular joint, and you articulate with the humerus like this, forming the glenohumeral joint. Okay, understood? So all these will be asked in your viva table. Okay, type of joint, how will you articulate, how many borders, surfaces, angles, different muscle attachment. Okay, and this groove is for the circumflex scapular vessels, very frequently asked. Okay, and this groove lies between the attachment of the teres minor muscle. Okay,